Medicare Mark here, and today on the Medicare Minute, we're going to cover from the Medicare.gov website what Medicare covers. I'm actually going to read a long list of things that it says it covers. However, I'm going to dig deeper and show you how one of the things, at least one of the things on the list that it says covered, once you dig a little deeper, it says it's not covered. So please be patient, wait until I go through the whole list, and then you're going to see where I take right off the Medicare website something that was supposed to be covered, and then they say it isn't covered. So they say both ways. And that's why you need a rep like me or independent rep to help you make all your decisions. Enjoy today's Medicare Minute, and we'll be back soon with future Medicare Minutes.
Welcome to the Medicare Minute, providing clear solutions to your Medicare questions. Our insight and experience will help you prepare and navigate the overwhelming task of Medicare enrollment by giving you the peace of mind you hope to enjoy during your retirement. It's time for the Medicare Minute, presented by Medicare Mark.
All right, we're on the Medicare.gov website. This is Medicare Mark, and you go to Medicare.gov, Medicare.gov. This is the official Medicare website, and you can see on the top here it says sign up, change plans. You don't want to do that. You want to use me or another insurance agent to help you do those things. Your Medicare costs, what Medicare covers, the drug plans, Part D, supplements and other insurance, etc. So if we look at your Medicare cost, get help paying costs. Well, a lot of people don't realize that sometimes based on income or other reasons, you can actually get help in paying for Medicare. Remember, Medicare Part A is no cost if you work 40 quarters in your life, but Medicare Part B, based on when you got into Medicare and based on your income, if you're at the level where it's like 170,000 as a couple, 85,000 as a single in income, then basically you're paying the lowest Medicare you can. And this year for someone getting on Part B, it's $135.50 for Medicare Part B. Now, sometimes people can't afford those costs. So you can see over here, you have Medicaid, Medicare savings programs, PACE, Save on Drugs, programs for people in U.S. territories, and extra help for Part D. So anyway, Medicaid. Medicaid is a joint federal state program that helps with Medicare costs for some people with limited incomes and resources. Medicare Savings Programs is a state Medicare savings program, MSP. Programs help pay premiums, deductibles, co-insurance, co-payments, prescription drug coverage costs. PACE, P-A-C-E, Program of All-Inclusive Care for Elderly, is a Medicare Medicaid program that helps people meet healthcare needs in the community. You can also save on drug costs, qualify for extra help from Medicaid to pay for the cost of the Medicare prescription drugs coverage, Part D, that's D as in dog. You'll need to meet certain income and resource limits to qualify for that. There are programs for people in the U.S. Territories, programs in Puerto Rico, the U.S. Virgin Islands, Guam, Northern Mariana Islands, American Samoa, for people with limited income and resources. Also, you can find your level of extra help for Part D. Part D is the drug coverage. Information for how to find your level of extra help for Medicare prescription drug coverage, Part D. Insure Kids Now is a children's health insurance program. They call it CHIP, C-H-I-P, provides free or low-cost health coverage for more than 7 million children under the age of 19. And CHIP covers U.S. citizens and eligible immigrants. And then there's SSI, or Supplemental Security Income. It's a monthly benefit paid by Social Security. SSI is for people with limited incomes and resources who are disabled, blind, or age 65 or older. SSI benefits aren't the same as Social Security retirement or disability benefits. So once you're going through this to figure out how to get extra help, then you can click on each individual tab. So if we click on the Medicaid tab, then a lot of more information will come up about how that works. So let's just go over the Medicaid tab. Medicaid is a joint federal and state program that helps with Medicare costs for some people with limited income and resources. It also offers benefits not normally covered by Medicare, like nursing home care and personal care services. Well, how do you apply for Medicaid? Each state has different rules about eligibility and applying for Medicaid. So You can call your state Medicaid program to see if you qualify and learn how to apply, or you can go through an independent agent. Maybe he'll be able to help you figure out how to do that. There's something called Medicaid spend down. Even if you have too much income to qualify, some states will let you spend down to become eligible for Medicaid. The spend down process lets you subtract your medical expenses from your income to become eligible for Medicaid. In this case, you're eligible for Medicaid because you're considered medically needy. To be eligible as medically needy, your measurable resources must also be under the resource amount allowed in your state. So once again, you can call your state Medicaid program to see if you qualify or learn how to apply, or you can call a local agent in your current area where you live. And then there's dual eligible. If you have Medicare and Medicaid coverage, most of your healthcare costs are likely covered. You can get your Medicare coverage through your original Medicare or a Medicare Advantage Part C plan. If you have Medicare and full Medicaid, you'll get your Part D prescription drugs through Medicare, and you'll automatically qualify for extra help paying for your Medicare prescription drug coverage, the Part D, and Medicaid may still cover some drugs and other costs that Medicare does not cover. So who pays first, Medicare or Medicaid? Or Medicaid never pays first for services covered by Medicare. It only pays after Medicare. Employer group health plans and or Medicare supplement plans or Medigap plans, insurances have paid. So once your other insurances pay, that's when the Medicaid kicks in. So as you see, that's under the tab, getting help, paying for cost, and that was the Medicaid tab. So it's a pretty good resource here, Medicare.gov. And let's get into the next part. We're not going to go through all these right now. That could be a different video. So let's go to Part A, Medicare cost. All right, so Part A. Part A cost. How much does Part A cost? Premium-free Part A. You usually don't pay a monthly premium for Medicare Part A, hospital insurance coverage, if you or your spouse paid Medicare taxes for a certain amount of time while working. This is called premium-free Part A. Most people get premium-free Part A. You can get premium-free Part A at 65 if you already get retirement benefits from Social Security or the Retirement Board. You're eligible to get Social Security or railroad benefits but haven't filed for them yet, or you or your spouse have Medicare covered government employment. If you're under 65, you can get premium-free Part A if you got Social Security or Railroad Retirement Board disability benefits for 24 months, or you have end-stage renal disease, ESRD, and meet certain requirements. So if you pay, or if you have to buy Part A, you'll pay up to $437 each month if you paid Medicare taxes for less than 30 quarters. That's 4 quarters a year, or to get to 40 quarters, you need 10 years of 4 quarters per year. This is saying that if you have less than 30 quarters, you're going to pay $437 each month for Part A. Now remember, most people get premium-free Part A. Then the standard Part A premium is $437, like I just said. If your Medicare taxes, if you paid Medicare taxes for 30 to 39 quarters, the standard Part A premium would only be $240. And once you hit 40 quarters, it would be $0. In most cases, if you choose to buy Part A, you must also have Medicare Part B medical insurance, pay monthly premiums for both Part A and Part B. It says contact Social Security for more information about the Part A premium. Basically, though, when you get mailed your Medicare card, if it's automatically mailed to you because you're collecting Social Security, you'll see it'll say Medicare Part A on it, and then your card will possibly also say Medicare Part B on it. Medicare Part A hospital, Medicare Part B medical. And that's the Part A premium. So Part A late enrollment penalty. We won't get into that now. We'll talk about penalties at a later time. We'll get into Part B costs, and then we'll wrap this we'll wrap this podcast up. Part B costs. Some people automatically get Medicare Part B or medical insurance, and some people need to sign up for Part B. Learn how to and when you can sign up for Part B. If you don't sign up for Part B when you're first eligible, you may have to pay a penalty or a late enrollment penalty. Like I just said, there's probably going to be a late enrollment penalty for Part A if you do it wrong, Part B if you do it wrong, and possibly Part D as a dog if you do it wrong. We'll cover that in another podcast. So how much does Part B cost? Part B premiums. you pay premium each month for Part B. Your Part B premium will be automatically deducted from your benefit payment if you get benefits from one of these: Social Security, Railroad Retirement Board, or the Office of Personal Management. If you don't get these benefit payments, you'll get a bill. Most people will pay the standard premium amount. If your modified adjusted gross income is above a certain amount, you may pay an income-related monthly adjustment amount, or IRMA. Income-related monthly adjusted amount, IRMAA, IRMA. Medicare uses a modified adjusted gross income reported on your IRS tax return from 2 years ago. This is the most recent tax return information provided to Social Security by the IRS. The standard Part B premium for 2019 is $135.50. Most people will pay the standard Part B premium amount if your modified adjusted gross income reported on your IRS tax return from 2 years ago is above a certain amount. You'll pay the standard premium amount and an income-related monthly adjustment amount, or IRMA. IRMA is an extra charge added to your premium. So here's a little chart. It says if your yearly income in 2017, because right now we're in 2019, for what you paid in 2019 was, so in other words, if your income as a single person was $85,000 or less, or if you filed a joint return $170 or less, or if you're filed married and separate tax returns of $85 or less, you pay in 2019 $135.50 for Part B. However, if your income is above $85,000 as a single individual and up to $107, or above $170 as a couple up to $214, then you're going to have to pay $189.60 for Part B. Above $107 and below $133,500 as a single, and above $214,000 and up to $267,000 as a couple, you would have to pay $270.90 for Part B. Then you can see the next thresholds: $352.20, $433.40, and then if you're above $500,000 as a single or above $750 as a couple, you're paying $460.50. When most people on Medicare are only paying $135.50 for Part B every single month. So that's the income-related adjustment that based on your income, you might have to pay more for Part B. Now, the Part B deductible and coinsurance, you pay about $185 per year in 2019 for your Part B deductible. So you have your Medicare card, the red, white, and blue. It has Part A and Part B. The deductible for Part B, you pay the first $185. That's kind of like when you go see the doctor, and then Medicare will kick in. After your deductible is met, you typically pay 20% of the Medicare approved amount for these. Most doctor services include most doctor services while you're hospital inpatient, outpatient therapy, and durable medical equipment. Now, that's if you just have a Medicare card and no other insurance like a Medicare supplement or Medicare Advantage plan. Thank you for listening to the Medicare Minute. I'm Medicare Mark, and we'll see you again next time.
Thank you for listening to this episode of the Medicare Minute with Medicare Mark. For more resources based on today's episode, head to MedicareMark.com and receive free access to videos, additional episodes, show notes, and more ways we can provide clear solutions to your Medicare questions. We look forward to providing more truth about Medicare right here on the next episode of the Medicare Minute. Take care.
Hey there. Thank you for listening to my husband, Medicare Mark, on Medicare Minute. If you enjoying the content, please be sure to subscribe. Every little bit helps to get this important information out to people. So I appreciate your help. If you miss an episode or looking for additional information, be sure to visit MedicareMark.com. You can find previous episodes in our video library. Are you looking for answers on topics that Mark did not cover yet? Leave us a message at MedicareMark.com and we will work it on a future podcast. Thanks for listening. Until next time.